students, let us learn this topic, gene therapy, and also have a look at some of the important questions that have appeared in the previous year board papers. So, what is gene therapy? They are a set of methods which help in correction of a gene defect that has been diagnosed either in a child or an embryo. How to do this? We need to replace the defective gene with a normal copy of the proper gene. This was done first in a 4-year-old girl in the year 1990, and it was done for a ADA deficiency. For that, definitely you should know what is meant by ADA. ADA stands for adenosine deaminase, which is an enzyme. What is this enzyme required for? It is required for your immunity. Now, is this enzyme present only in a particular set of cells? No, they are present in all the cells. However, it is present more in your lymphocytes. I hope you remember what are lymphocytes. They are blood cells. They are WBC cells in your blood. All right. Now, this ADA defect or the enzyme defect happens when this gene for this enzyme, that is ADA gene, is deleted. Now, what is some of the ways to cure this disorder? We definitely started with the topic gene therapy, but this may not be the only cure, isn't it? So, there are other ways of curing it. First one is bone marrow transplant. Why bone marrow? You know, all the immunity related cells, especially the lymphocytes, which has the maximum amount of this enzyme ADA, is found in bone marrow. So, transplanting or transplantation of bone marrow is one option. Another is enzyme replacement therapy, that is injecting this enzyme adenosine deaminase into the patient. That is, those are the two methods. But these are not complete cure. These are to be done multiple times. So we need to look for our gene therapy method. All right. So what are the steps that are included in gene therapy of this particular gene, a particular disorder? Sorry. First and foremost, we need to grow lymphocyte cells of the patient. So what are lymphocytes? These are WBC cells that we need to extract from the blood of the patient. Then grow it in nutrient medium in the lab. In vitro means in the lab. Then second step is to insert this gene ADA cDNA into this lymphocytes using a vector called as retrovirus vector. Once that is done, once you've inserted ADAC DNA, complementary DNA gene into the lymphocyte cells, return these lymphocytes into the patient. But again, this has to be done periodically. So what is a permanent cure? What can we think of where you don't have to keep doing this procedure again and again? So what is a permanent cure? The permanent cure is if you extract the ADAC DNA gene from the bone marrow cells and introduce at the early embryonic stage of a possible patient. So obviously with molecular diagnosis, we know that this gene defect is going to happen for this particular baby, which is probably in this stage or in this stage of growth. So what do? We need to insert this gene into the early embryo stage, maybe to the 2-cell stage or the 4-cell stage of the embryo. Now, let's have a look at all the important questions that have appeared. First question, what is gene therapy? Please go through all the questions quickly and try to answer them. In case unable to answer, please go back to the video and watch it again. That should cover all your questions. Second set of questions here. There you go. Thank you.